Hey, this is Dr. David Hausmann with Stronghold Health, and today we're going to be going through the top 10 myths regarding chiropractic care. Number 6, if you start chiropractic treatment, you have to do it for forever. I always have to ask a question with this, rhetorical, and I know you can answer it yourself. Are there certain things that we have to do for our health? Yes, absolutely. We have to drink healthy, drink water to sustain our bodies. We have to eat clean organic food. We have to exercise and move our bodies regularly. Dental care, we have to take care of, brush and floss our teeth to maintain the health of our teeth. And so there's certain things at the end of the day that we have to do, generally speaking, for our health. The number one thing you can do to take care of and maintain your nervous system, arguably the most important system in your body, is chiropractic care. And so with that being said, does that mean you have to get adjusted for the rest of your life? Not necessarily. There's plenty of examples of people that start chiropractic care, overcome a neck or low back problem or another specific health issue, and then they don't get adjusted for the rest of their life and they do good. Arguably speaking, the ones that maintain their spine with some preventative treatment, maybe once a month or a couple times a year for realignment, end up doing far better. So at the end of the day, you don't have to, but it would behoove you to. Number 7, chiropractic care requires referrals. In my experience, we're in network with pretty much every major medical health insurance company. Arguably, we're only in the state of Tennessee, but we haven't really seen that to be the case. Most often, chiropractic care is a primary portal of entry, and in the state of Tennessee, chiropractors are actually considered a primary physician, primary healthcare physician, which a lot of people don't know. And so with that being said, we are in a specialty realm where insurance coverage can be considered specialty, but it doesn't require a referral. The most that we've seen from insurances is they might require a pre-authorization, which is a document that we, the provider, have to send to your insurance company to get coverage approved. Outside of that, it doesn't mean you have to go to a different doctor to come see us in the first place. You can just come directly to us. Number 8, chiropractic care is not safe for children. BS. That's bad belief systems. At the end of the day, chiropractic care is one of the gentlest and safest approaches actually for pediatric patients. My own experience working with both of my children, my daughter Gigi, for example, we adjusted her, gave her first chiropractic adjustment while she was still connected, umbilical cord on mom's chest. 1 minute after birth, maybe it was 30 seconds after birth. It was the very first thing that I did was check the top bone in her neck to make sure the birth trauma itself did not misalign it, which it did. And she needed a lateral atlas adjustment. And so for pediatric patients, it doesn't require a lot of force. It's not snapping bones like you see for adults. It's often the same amount of pressure as testing the ripeness of a tomato for the amount of force. It's very, very gentle. There is no twisting and manipulating. For children, they still have growth plates, the bones aren't completely fused yet, so it has to be a very gentle approach. Chiropractic care is fantastic for pediatric patients. Number 9, chiropractic care just cracks bones. The truth of the matter is we actually aren't cracking any bones. I think in people's heads when they hear the crack noise, they think a bone is snapping or a bone is rubbing on another bone, creating a pop noise. What actually happens is when we move a bone on a joint, how it articulates with the bone above or below it, your body has a joint capsule that's full of fluid and air gas. And so when we move a bone and realign it back into the right position, just like when you pop your knuckles, you hear a pop noise. And that pop noise is actually carbon dioxide or gas releasing or escaping very quickly from the joint capsule itself. So the pop noise is just a side effect of realigning the bone. Taking two bones that are out of position and putting them back in the right position. The pop noise is also a relief for many people. The pop noise itself has a side effect where the body releases endorphins, and endorphins are your feel-good hormones. So naturally speaking, if you pop your own neck, even though you might not be realigning it to where it needs to be, you're still gonna have an endorphin rush and a feel-good hormone. So back to, does chiropractic care hurt? No, most people, it actually feels really good. We're not just popping and cracking bones, we're realigning the joint. And number 10 myth, chiropractic care is just placebo. Nonsense. There's so much research out there. You can Google and get research all day long on all the different things that have been measured biochemically speaking anatomically speaking, with chiropractic care and the positive patient outcomes. A couple of simple examples is before getting adjusted and then after getting adjusted, seeing an increase in blood oxygen saturation. Before getting adjusted, after getting adjusted, seeing an increase in vital lung capacity. Reducing forward head positioning, for instance, by 1 inch increases vital lung capacity by upwards of 60%. That means how much oxygen you can hold in your lungs. We're talking about oxygen saturation to central nervous system and brain cells. Long-term chiropractic patients, there's a study that measured serum thiol levels. Serum thiol levels being a marker of longevity, but also a marker of the likelihood of an individual to have chronic illness. And what they found is chiropractic patients that had 2 years of chiropractic care or longer, so these are dedicated individuals that are preventatively taking care of themselves, those patients had higher serum thiol levels, meaning they had a lower incidence overall of chronic diseases like metabolic syndrome, cancer, diabetes, so on and so forth. So chiropractic care is far from placebo. Chiropractic care is clinically proven to have positive outcomes on your health. These are the 10 myths regarding chiropractic care. I hope that you enjoyed it. If you have any questions, comments, feedback, please go ahead and drop it in the comment section below and let us know if there's other content that you'd like for us to film, and please give us a thumbs up, a like, and hit that notification button so you can get notified when we have new videos drop. Bonus content, bonus myth. I know that you were thinking it while you were watching the video and you heard me popping my knuckles. I can't even do it anymore because I just popped them all, but does popping your knuckles, is it bad for your joints, or is popping your neck bad for your joints? Not necessarily. There was a rheumatologist that did a study, I don't remember the guy's name, specifically how long, so I'm roughly quoting this, but he popped all the knuckles on one of his hands and not on the other, and did it for, I think it was once a day for upwards of 2 or 3 years. And then they did follow-up x-rays and looked at the joint spacing and looked at the joint integrity and health, and there was no difference between the hand that he popped the knuckles and the hand that he didn't pop the knuckles. So just remember, when you pop a joint, especially spinal joints, it does relieve a little bit of tension. You might not be aligning it back to where it needs to be, and that's why x-rays come into play, and it's highly recommended you go see a chiropractor with x-rays, and they realign you based on those measurements. But either way, when you pop the joint, body releases endorphins, feel-good hormone, you feel better for a little while, ain't gonna hurt you. But that doesn't mean go adjust your wife and go snap your neck. Go see a licensed chiropractor.